blessing, money, testimony. Go to follow you they go. This year, good.
Hello, and welcome back to this channel. First, I want to say happy new year. This is my first video for the year 2023. Gosh, I felt like I blinked and 2022 went away and 2023 came in. That's to tell you, you need to just do what you need to do for yourself. Get out there, set your goals, accomplish your goals, and keep moving on. Don't let anything hold you back. Don't let anything stop you. All right? If you're thinking about getting into the healthcare industry, go ahead and do it. Become a home health aide, become a CNA, LPN, RN, get your BSN, get your MSN, become a family nurse practitioner, become a social worker, become a physical therapist, become an occupational therapist, become a dialysis nurse, become a dialysis tech, become an ultrasound technician, become an imaging technician, become an imaging, do everything, become a doctor. Just go ahead and do it. Because before you make up your mind, it's going to be 2024 and you're still waiting on getting it done. Or while you're at it too, get in there and make that money. So thank you guys for subscribing, for commenting, for liking. I appreciate your comments so much because I like to interact with it. I like to know people through their comments. You know, we're not out there in real life doing things. So social media comments and, you know, we get into it and we get to know each other and get to know what people are up to, what people are thinking, what direction people are taking. And it really help others who reads it. So take your time and do that. If you're just stumbling on this channel, my name is Janice. I cover all things nursing on this channel. Take your time, subscribe, comment, and like. Let's build this family together. If you have any topic that you want to be covered on this channel, let me know. I have a lot of experience. I'm trying to get it out there. My goal is to put video out every 2 weeks. I wish I could do every week. If I have the time, I will do it, but I stick to every 2 weeks because I have a very busy schedule with work and home. And I just want to keep on that schedule for now. But if anything changes, of course, I can definitely go ahead and put more videos out there. But I have a lot of videos that I want to get out there, and rest assured that I'm going to make time to put them out there. I just need the time to put them out there. All right? Your girl has a full-time job, maybe 4 more time job, and, you know, other things to do. So I'll try to get this information out there for you as best as I can. Okay, so last video I talked about my experience within the nursing home settings. I told you guys I ran from there within 3 to 4 months, and I made my way into home care. If you want to know more about that video or that experience, please check out my previous video. I also have other videos that I uploaded on the channel that are very informative. So today I'm going to be talking about my experience within the home care settings. Now this video is going to be brief as well. If you have any question, comment down below and I can help you elaborate on that more through the comment section or through any means necessary that you prefer. But home care. So I did home care for about 6 to 7 years of my career, and I really liked it. I started off providing care in the home settings as a one-to-one nurse, meaning that the nurse to patient ratio was 1-to-1. I'm going to be covering this topic in the point of a registered nurse because that was my position. However, I just want to put out there that LPNs can also do home care one-to-one cases. However, I am not aware of the fact that LPN can work in the home care as a community health nurse, just because there's a lot of assessment required for that position. However, with the one-to-one cases with patients in their home who are stable, who are chronically ill, yes, a LPN can cover cases within the home as a one-to-one case. So When I worked as a registered nurse, and I saw patients one-to-one. I go into the patient home and I stayed for 12 hours. I covered 12-hour cases at the time. And I provided care for patients with respiratory problem, cardiac problem, thyroid, every comorbidity that you can think about. However, keep in mind that those patients in their homes, they are stable. That's why they are in the home. That's why you can go into the home and provide care. We are not providing care for acutely ill patients in their home. We are providing care for patients who are chronically ill. Patient with dementia, Alzheimer's. You have the youngest population, who children born with cerebral palsy, mental retardation, and other health issues. You have patients in the house who are on the trach and on the vent within the home. We provide care for them. You have patients who require wound care. We provide wound care for them. You have patients who have G-tubes and require feedings within the home. We go in there and we do that. We supervise the patient. We keep their eye on them for any changes. We contact the doctor and the doctor intervene. That's the care of a home, the responsibilities of a home care nurse. Our ultimate goal as a home care nurses is to keep the patient out of the hospital. As a matter of fact, if you work in home care, you know that the state can reimburse the home care agency if they're able to keep patients out of the hospital for over 30 days of their discharge. So I did one-to-one cases for a year, and I really liked it. A really great upside about one-to-one cases is that it gave you the chance to develop yourself as a professional. While I was doing one-to-one cases, I was enrolled in school to get my bachelor's. I stayed in those one-to-one cases, and I completed my bachelor's degree. I went into the patient's home, provide care for them. After I provided their care, giving their medications, make sure they are clean, make sure they are fed, and we are comfortably sitting in their home. I took my laptop, typed up my papers, did my discussion boards, sent it in, and I stayed one-to-one cases until I graduated with my BSN. So for those of you who are thinking about going back to school, the home care one-to-one cases, you can go back to school and complete your degree. That's an upside. After I got my bachelor's, I moved on to community health nursing. I joined the Visiting Nurses Association, and I started to work as a community health nurse. Now, when you work as a community health nurse, you are providing care for about 7 to 8 patients a day. You drive to those patient houses, or you take public transportation, whatever means necessary to get there. You get there, you provide care for the patients anywhere between 30 minutes to an hour and a half. For cases that are revisits, those are cases where you go to pre-put the patient medications, you go to check the patient blood pressure, you go to do wound care, you go to do any kind of site care that came from the hospitals, you go to supervise the home health aide. Those cases takes you anywhere between 30 minutes to 45 minutes. You take care of those patients. And then you have the cases where you have to go and do a admission. An admission is a patient who is just enrolled into your home care for the first time. Now, when you go in there as a case manager, community health nurse, you are assessing everything that the patient needs. Do they need physical therapy? You bring in a physical therapist. Do they need occupational therapy? You bring in an occupational therapist. Do they need social worker? You bring in a social worker. Do they need home health aide? You bring in a home health aide. Do they need adult protective services? You bring in the adult protective services. That is your duty. You're in a community, you're doing your assessment, and you're bringing in all the things that those patients need in their home to prevent them from going back to the hospitals. So you might go into a patient's home and they don't need your services every time as a registered nurse. They don't need you going in to take their blood pressure. All they need is a physical therapy, for example. If they require physical therapy, you bring in a physical therapist, and that physical therapist takes over to care for that patient. However, you are still responsible to check in with that physical therapist to make sure he or she are doing what they're supposed to do. Now you're going to call them up. Hello, I'm calling to check on Mr. Brown. He's getting physical therapy from you. How is he doing? How many more days does he need with your services? How is he progressing? What else does he need? And then the physical therapy will let you know. When are they going to be discharged? Now, once that patient is discharged from physical therapy, you go in as the nurse and you discharge them from your services because they no longer require you as a nurse and they have been discharged from physical therapist. So that's how the community health nursing work. You are there to provide education. You are there to keep the patient comfortable in their home. Now, the upside also for being a community health nurse is that you can work on your own timing. Let's say within a daytime, you have to see 7 to 8 patients. When you get up in the morning and you have children, you can decide to start late. You get your kids ready, get them on the bus, take them to or drive them to school. You come back, get on the phone, call your patients, give them the times that you're going to be in to see them, and you go and see them. You can finish early, come back, pick up your children, drive them home, and make dinner and do everything else that you're supposed to do in your home. So I loved that I can take care of home and take care of work at the same time. So you are creating your own schedule. It's up to you to what time you're going in to see your patients during the day. Nobody is telling you, you got to be here at 9 o'clock. You got to be here at 10 o'clock. No, you get up in the morning. You can choose to start at 7 in the morning, or you can choose to start at 9:30 to 10 o'clock. That's your business. All that matters is that you complete your patient caseload within that time frame. Now, I know that some home care nurses don't like the fact that they have to take some notes, some documentation home to do. That requires you to be consistent. That requires you to be organized. If you can organize yourself better, you don't have to take any notes home. Because when I was doing home care, when I go into my patient's home, I completed my notes right there. I pre-pour your medications, do your vitals, document everything right there, and go on to the next patient. I do my wound care, I do my documentations, and go on to the next patient. If you're a home care nurse and you are having hard or tough time managing your documentations, I advise you to create templates. Sit on your computers and create templates for yourself so that way you use it throughout your patients. All you got to do is change what don't belong and put in what belongs. That helped me a lot. And a downside for home care is that you're going into people's homes. If you're the person who don't like going to people's homes, then home care is not for you. However, you know that when you're going to other people's homes, it requires you to be respectful of their homes, respectful of their culture, respectful of their environments. I didn't have any problem with that whatsoever. And you go into patients' home who are smoking in their homes, who have dogs, who have pets. Maybe you're allergic to animals. You are allergic to cigarette smoke. What you tell the patients? Listen, I'm going to be here tomorrow to see you to provide your care. When I'm coming in, please do not smoke in the home while I'm here or before I get here. Please, can you put your dog away? Can you put your cat away for the time that I'm here with you? The majority of them are very welcoming to that because they want the care in the home. You go out here, you see them, and you leave their home. And for those of you who are nervous about going into the tough neighborhoods, your agency can provide escorts for you. They will come with you, usually those huge looking guys. They will take you into the patient's home. You provide your care and they come out with you. Okay? Because the patient is living in a neighborhood that is considered tough or not so safe, or their home is not well kept, that don't mean that they don't deserve care. They do. They need those help, especially those elderly patients. They need those help. So we have to help them. It is your responsibility as a home care nurse to find a way to help your community. That's why you're called a home care nurse or community health nurse. So if they require social worker or adult protective services, you can call them in. I know when you say adult protective service, people say, oh my God, you're going to get them to take that home. No, They can come in and provide deep cleaning. They can come in and provide a temporary environment for the patient to be while they clean their home. You have all of that, and the majority of the insurance will cover deep cleaning for those patients. All right, so that's the home care nurse as a whole. I left home care, or I'm taking a break from home care because I wanted to adventure in other places of healthcare. That's the best thing about healthcare. You can make a decision to leave the hospital today and go into home care. You can decide to leave home care and go into the hospital. It's up to you. It's up to you what experiences you want to experience. Some other people feels comfortable sitting in one position. Other people feel comfortable adventuring into other positions, into other area of the healthcare. I'm glad that I have been doing that because I'm telling you, it helps a lot. If I go into another facility today, I know how to handle myself. I know how to, work, and I know because of my multiple experiences. So when I left home care, I went into correctional nursing. That's going to be my next video. I'm going to tell you my experience with that. It was a whole nother experience for me. But I'm glad that I did it because I have that experience on my resume. So will I recommend home care for new nurses? Definitely. You are working at your own pace. There is nobody out to get you for your license like the nursing homes. So I definitely recommend it for new nurses. It's a very great settings to work in, and they give you the time to also do what you want to do for yourself. You're not on anybody's time. You are just making sure that you see your patients and do what you're supposed to do. So if you have any questions, let's talk about it. Until then, I see you in the next 2 weeks, possibly 1 week, who knows? So take care, like, subscribe, and comment, and bye for now.
This year, blessing, money, testimony. Go to follow, you they go.